Hey everybody, this is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center. Today I have my great assistant, Kaylin, here, and I wanted her in this video to kind of give her feedback, what we've seen with our patients. We do a lot of snap-on dentures, which are also called overdentures technically, and all-on-four that we do here at the practice, and so she can give us some feedback from what we've seen from our patients. And I also wanted to kind of talk about some of the pros and cons of a snap-on denture versus all-on-four, and also, you know, we know basically cost is a huge factor, right? So that's what we see patients, like why they make their decisions. And also I want to kind of go over what the doctor will typically, when they're reviewing with a patient, like what are some of the things that we're looking for that would make a patient a candidate for a snap-on denture versus an all-on-four. So hopefully we can hit on some of those things and really help educate patients that are out there looking at some of these options. But we have seen in the past also that patients seem to know more about snap-on dentures, right?
Oh, yeah.
Yeah. People are typically, because I like to ask my patients, how do they find us? Like, what are the things that you're looking for? And so people typically are looking for, when they're hearing about implant-supported dentures, they hear about the
snap-on
denture. They'll call it.
But is that because it's been around longer, or?
Yeah, you know, so they've both been around for a long time, for decades. All-on-fours really started to get popular like early this decade. I mean, last decade. But for whatever reason, I honestly can't tell you. Like, even when in residency, I was in residency 2008 to 2011. I was doing snap-on dentures, and it wasn't called an all-on-four. Like, basically, it was an all-on-four concept, but it was just more spread out in time. But we were doing a lot of them back then too. But you know, like having practice, like, you know, like I'm heading into my 12th year of practice now, just having done so many of these options on patients, like, you know, just patients do seem to be more they are way more satisfied with the all-on-four. Yeah. So let's actually but I don't want to dismiss like snap-on dentures. I really want to like talk about
some people like
things.
it.
Yeah.
I mean, we've had patients that, you know, like have gotten snap-on and they absolutely love it. They have an upper all-on-four, a lower snap-on, and they have absolutely no problems. They don't see a difference. They are completely content with it.
However, there's also patients that have an upper or a lower all-on-four versus a snap-on.
And they end up switching to an all-on-four because they're like, I can't do it.
Yeah. And then one thing we could see right off the bat is like, here's a all-on-four model and here's a snap-on denture model. Like, look at how much more plastic acrylic there is on that, right? There's a snap-on denture. Because these inserts that you see here on a snap-on denture, it's like a clip, right? So it's like
a button.
Yeah, it's like a button, right? So what's stronger, something that's screwed in or something that's snapped in, right? And so that the snap in, like, it can only do so much that like it's when you're biting and you're creating a little micro movements, you need to have the extension of these, like the denture, what we call the flanges of the denture, making contact with the gums of your mouth to be able to give that support whenever you're chewing. So that's why they're so much bulkier. And like, I can think of a patient right off the bat that she had an upper, due to finances, she did an upper all-on-four and she did a lower snap-on. And she loves her all-on-four. Mm-hmm. She was mind blown at how much bulkier the overdenture was.
Even though we explained it, we told her, we gave her all her pros and cons up front. It's different when it's in your mouth.
Mm-hmm. And then you gotta, like, and maybe like if she was only in the upper, like, overdenture from the beginning too, she would have been like, oh, this is what it is.
Yeah.
But having been in like an all-on-four, she started to see what a huge significant was, how significantly different it was. And then she switched.
Yep.
Right? So yeah, basically,
I feel like we see more patients that switch from all-on-four or from snap-on to all-on-four for sure.
So like that's about like setting expectations, right? Mm-hmm. So I like to like under promise over deliver. I had a patient tell me some career advice that like 11, 12 years ago. He was like, I got a big piece of advice for you. Like, try to under promise over deliver, and that's words I've been living by all these years. I tell patients, all right, if you want to consider a snap-on denture, I'm taking it like, ideally I want to take a patient that's already like in dentures, frustrated, doesn't like them, and says, hey, I need to like step it up to something else. I was like, okay, great. if your issue, like most people, their denture is just kind of flopping all over the place, you got to use a lot of denture glue. Then I say, or they hate that the plastic's covering the roof of the mouth. They can't taste food as well. They hate using all the denture glue. Say, all right, cool. We got implant supported denture, like it's like a snap-in denture, right? Yeah, it's gonna stay in place.
Big upgrade for them.
It's not like having your own natural teeth again, but it's a big upgrade. If you want the best option, again, I have to tell you, something that's screwed in versus snapping is going to be a way, it's going to feel a lot more comfortable, like having your own natural teeth again, right? Now, when we're taking a patient that has their teeth and we're telling them, hey, you're going to lose your teeth, like, we need to look at options. We got the regular denture, we got a snap-in denture, and we got an all-on-4. Tell them about pros and cons of each. All-on-4 is typically going to be more expensive. However, what I think that where patients are being misled is the fact that a lot of people will tell them to do a snap-in denture, but if you're doing a snap-in denture and you need to do all this extra bone grafting, sinus lifting, more bone, adding bone to thicken up your bone too, after all that added expense, it's
not a big cost difference.
There's no cost difference, right? And then at that point, I'm telling patients that's a serious injustice that you're doing at this point, doing a snap-in denture when you would be way happier with an all-on-4.
Oh yeah,
right.
And all the steps and stuff that it takes to even get a snap-in denture, because you're in a traditional denture for a while, so you're having to go through that waiting period.
Right. And here's a little secret that I'll tell patients is, like how I feel as I'm doing my job is it's not just about doing procedures on patients. It's about making having satisfied patients, right? I want to basically, if we're doing treatment, if we're gonna offer an option like a snap-in denture and all-on-4, I want you super happy with the results, right? I can do that with an all-on-4, but sometimes with a snap-in denture, I feel like I'm kind of functioning with my hands tied behind my back, right? Because just again, it's all about setting expectations in regards to what we tell the patients. Okay, cool, it's going to be awesome. It's going to be better than having your own having a regular denture. It's going to stay in place a heck of a lot better. But again, if you expect it's going to be like having your own natural teeth again, that's not a realistic expectation. And I'm never going to be able to meet that expectation, So in that sense, I feel like if I want to have a very satisfied customer, I want to direct them towards an all-on-4. Now, the beautiful thing about all-on-4 too, though, is with everything having gone more digital and how we started using the digital process, we've been able to bring that cost down. So yeah, again, that discrepancy between a snap-in denture and an all-on-4, that financial discrepancy is becoming smaller and smaller and smaller. And then also, if you needed extra bone grafting to do an overdenture, then absolutely that cost, the difference is hardly there anymore. So then I tell patients, listen, it makes no damn sense to be doing a snap-in denture anymore. We need to do an all-on-4 for you. You're just gonna be way satisfied. You just gotta trust me on this, right? And the other thing too is listen, again, like I said, I feel better about what I do, but also my business does better. Satisfied patients aren't coming back all the time because they're not coming back for adjustments. Hey, there's something wrong with this, there's something wrong with this, come back every week. That doesn't happen with all-on-4s, right? Overdentures, snap-in dentures, yes, this does stay in a little bit better, but then you're going to have a sore spot. Hey, can you adjust this spot here? Hey, why is this flexing a little bit? Hey, after 3 months, 4 months, hey, why is my denture getting a little bit more loose? And that's because of the male inserts, these little nylon inserts on the bottom of this denture, right? So those wear over time, right?
They become looser.
Yeah, and so then we have to take them out, swap them out, and put new ones in, right? Let me show you what those look like real quick. So here are these what we call the male inserts, right? And they're different color coded to basically indicate how strong or how flexible or unflexible these things are going to be. And so those things wear over time. And whenever and another thing that really comes into play too, and this is where I'm going to start talking about when I look at your x-rays, when I look at your mouth, when I look at your 3D scan, and I'm looking at your bone. If you have a lot of bone, and then it's great, and you have small sinuses, you have a lot of bone, your nerves are far away, then I say great, you're a great snap-in denture candidate because I can get those implants as parallel as possible. Whenever we're, I can show you right here. So this, when I like to look at this image right here, so this indicates a lower jaw overdenture, snap-in denture. So these are the abutments. And what we want them doing is we want to be as parallel as possible, so that when I'm putting this denture in these inserts, they're all like, you could see that they're pretty parallel. We want this going in like these implants drawing out as parallel as possible, so that this can go in without any obstruction. If this is going in with an obstruction because one of the implants are angled out, or they're all angled at different directions, and I actually created another video kind of talking about like nightmare scenarios and botched overdenture cases where the doctor had actually placed the implants at all crazy different angles, where how that actually affects this seating down properly. Now, we can compensate for some of that somehow by changing some of these little inserts, different colors, different strengths of how flexible these things are, to allow for divergences of angles. But they think that they act like that basically because we changed the insert, that's going to compensate for any angular changes, and that's not true, right? Like, in all practicality, like you'll start getting your denture moving like and getting all wonky, and then you're going to wonder what's really going on, and it's just unfortunately a limitation of the way that the overdenture is. So whenever we're placing these implants, overdentures, like snap-in dentures, kind of stress me out in that aspect. And even as like I placed like 10,000 implants in my career, I placed so many implants. When I'm doing an overdent, like a snap-in denture case, I'm trying to get your implants as parallel as possible, not trying to rely on these little inserts, allowing for me to have like discrepancies. So it's like very stressful sometimes trying to get those implants as perfectly placed as possible. The reason it's stressful is that everybody's bone is different. So if you are that patient that has very thick, vertically high, like abundant bone, and your sinuses are way back here, then it's way easier on me. But it's not all the time that we get patients coming in that their bone is perfect.
Right.
They've been in dentures for 5, 7, 10 years, and suddenly they want snap-in dentures, and they have extremely diminished bone. Their bone's super thin, or it's flaring out, and the bone has severe undercuts. So getting them an ideal result is very difficult. And there are sometimes patients that have so much bone loss that they're not really even a candidate. And then, like I said earlier, we can do all the bone grafting. By that point, it's $20,000, and now you've gone over the expense of even our cheapest all-on-4.
Right.
And so I feel like I'm doing an injustice or a
Right.
disservice to the patient, right?
And then the time frame from when you start to
Oh, good
actually
God.
getting your snap-on, you're going to be waiting forever.
So remember how I told you about like setting expectations? I literally tell patients this. I was like, if we do a snap-in denture, there's like so much healing time before the implants have integrated. We can't put in the parts to allow this denture to snap in from day one, because when you put it in and out, it's going to put forces on that implant when it's healing, and then it's going to cause your implants to fail. It's similar to what I ever tell you, like when we put a steel post in the concrete, we gotta let it heal, right? Am I gonna tell you that you can go up to that and keep shaking it? No, you don't want to. In all-on-4, because it's permanently screwed in and fixed, and it's not gonna have you're not gonna be removing it in and out, in and out, in and out. That's why we can put it in, provided your bone was strong enough on the day of the surgery. But yeah, that's, I literally, to set expectations, I tell them, hey, for about 4 or 5 months, you're gonna hate me, because
Yeah.
that denture is just gonna be a nightmare. And like a lot of times they don't even wear it.
Yeah. A lot of times
Right.
they come in and they're like, "It's in a cup.
Yeah.
Go."
I like, and they don't like it. So again, setting expectations, right? So yeah, like those are some of the things that we as a dentist will look at, right? And I also mentioned it earlier too, is like if your anterior bone flares out real far, it just becomes very difficult to be able to place those implants as parallel as possible. So that's actually one piece of advice I tell patients, because a lot of people start trying to get into implant dentistry. Again, I'm not trying to knock anybody, but if you want the consumer to be aware of like some of the things that are to go on, but like you'll have, and again, I'll refer back to the botched video, that we have seen a few cases of some dentists who just literally started placing implants on some patient, using, mini implants or implants to do a snap-in denture, and with disastrous results and upset patients, So if you want to avoid that, anyways, I don't want to say too much about that.
Yeah. And I still think that, even though patients understand, okay, I can do the waiting period, I can do the bone grafting or whatever, I can do the extra added bulk, they still don't understand that it's still going to move a little bit. Like, it's still going to have that little teeter-tottering shifting effect. It's not going to be permanently like the all-on-4 screwed in to where it does not move. It's still going to have a little bit of shifting, and that drives some people just crazy, especially because the floor of the mouth, when your tongue moves, if you're talking, chewing, it's still going to move a little bit, and that just bothers some people. And I think that's one thing that people don't understand. They think they do, and then they actually get it, and that's, I feel like, the biggest complaint we see is like, oh my gosh, why is it still moving?
Yeah. And then the only solution would be like, let's talk about that. So like the minimum that implants that you would want to lower, so like when you do a snap and denture, is 4, lower 2. The lower jawbone is way more dense. That's why you can have fewer implants. Mm-hmm. Well, here's the problem. You place some 2 like up front here, and so the denture kind of hinges off of that. But the problem is that when you start chewing like kind of like how you used to when you had all your teeth, you'll start getting a little bit of flexing back like in the back area. Mm-hmm. So then we can kind of fix that by adding 2 more implants back there too. Mm-hmm. Okay. However, now you place more implants, more inserts, the abutments, and we're starting to drive that cost up. At that point, it's better for sure. Patients are like, okay, this is a lot better. Mm-hmm. But again, it's like setting expectations. By the time they put 4 implants and they have an overdenture with all the abutments, then how much money have they spent? At that point, you literally can spend a few thousand more and get an all-on-4, which is night and day better. Mm-hmm. So, again, we understand that people are making their decisions due to finances, but just kind of letting patients to like understand. And I wanted to cover one thing real quick. So people are saying like, well, how can you get away by doing an all-on-4 if you have less bone and you could do less bone grafting and all that type of stuff? Well, the reason that we can do that is because of this. So this is like what we call multi-unit abutments, and so it allows us, like, simply, to simply put it, for us to place an implant at all these crazy angles, right? So overdentures need to be placed like as parallel as possible, but when we do an all-on-4, we can place the implant almost at any angle because we can compensate for how the angulation is with these abutments, these interface pieces that come between the actual implant and the prosthesis, right? So here's a 30-degree abutment, here's a straight abutment. You can also have 17-degree abutments, and also they have 45-degree abutments. And so that one little piece allows us to have flexibility to place your implants where your bone is and not even stress out about that. So quite frankly, it makes, when we, like the surgeon who's doing your procedure, it makes our lives way easier, way easier, and really like allows us to do an all-on-4. Now, overdentures do also have like a 15-17-degree abutment too, that you can compensate for some of this angulation, but it's not a cure-all. It basically can save you in some cases, but not in every case for sure. And so that one multi-unit abutment is the critical piece that really helps our patients have a way better result that we can do an all-on-4, compensate for angulation, all those things. So, I'm sorry.
Let me ask you, so we have some patients that say, I'd rather get a snap-on because I can take it out and clean it. All-on-4 just doesn't seem hygienic.
Right.
What is your thoughts on that?
The funny thing is, earlier in my career, we did way more snap and dentures than all-on-4. And that's because that concept. Mm-hmm. Being a periodontist, I'm a bone and gum specialist. I'm all about, like, if you're gonna talk to one specialty in dentists, or all of, like, one group of dentists out of all dentists that are more paranoid about bacteria, it's periodontists. Like, that's just what we deal with. We deal with bacteria, how it affects your gum and bone. And that was my rationale. However, and that's why earlier in my career, we did way more snap and dentures than all-on-4. And I pushed them in that direction. But then the more and more that we did on patients, I noticed that my patients that were in all-on-4 were way more satisfied. I had patients that were in snap and dentures that I recommended to be in snap and dentures, and they told me that they didn't love it, and that they thought about, like, hey, can I switch? They switched and they loved it. I had patients that have, due to finances, did an all-on-4 for snapping, and they want to switch to all-on-4 for the other arch because they love the all-on-4 way better. So in regards to like oral hygiene and stuff like that, like it never even phased them either. So in regards from a, however, I'll also tell you that, and I'll need to create another video, the way that the actual prosthesis meets your gums, the fake teeth and gums like actually meet your actual gums, how that transition line is designed, that can be designed so many different ways. If you're horrible about keeping your teeth clean, then sometimes we will design more of a hygienic space between there. But some people will hate that because stuff gets caught in there.
But some people like it because then they can clean better.
Yeah. So that really, the beautiful thing about that is when you do an all-on-4, like you actually have the opportunity to experience it. We're not putting you in your final. Actually, I have another. We made another video talking about do not do a final within 48 hours. Some centers out there will tell you to do your final, like why mess around with the temporary? We're gonna put you in your final within 48 hours, and I'll link it above. But that's like the worst thing that we could ever do with you, and like you'll have the temporaries to experiment, and you're gonna have so much bone and gum shrinkage anyways to feel what it feels like to like how this prosthesis meets your gum line. But we'll link that above. And they want to get you in a final. I'll call them out. They want to get you in the final to be done with you. Really, there's no reason to. It's the worst decision. I wouldn't do that to anybody in my family or anybody I care about. There's no way in hell I would recommend a final within 48 hours. But yeah. So that, to answer your question, that's what my thoughts are.
Yeah.
But to me, like the all-on-4, and I'm not here. Like this video was never about trying to trash a snap-in denture. We still do snap-in dentures occasionally.
We still have patients that like them, like we said.
Yep. But I would tell patients if they wanted my honest opinion, and again, due to the digital dentistry aspect of the all-on-4, how it's heading more digital, how we're using photogrammetry, all the like, and milling the prosthesis and 3D printing, and how much happier that the prosthesis doesn't break. There's just all-on-4.
What would you recommend to your mom? All-on-4.
For sure.
What would you get in your own mouth? All-on-4.
Yeah. Yep. Okay, so hopefully you guys found this. I know it's a little bit of a long video, but hopefully you guys found this information helpful. Please give us a follow, a thumbs up. Please leave us a comment if you have any questions, any video ideas. We'd be more than happy to do them for you. Thanks.